FAO has been the host for the Guttmacher Institute. Today, the training was mainly focusing on capacity building for communication.
I'm here today with the Public Health Ambassadors Uganda to lead a workshop on communicating research compellingly for advocacy. The workshop brought together a number of advocates from around Uganda. A lot of them focused on sexual and reproductive health and rights issues, HIV and AIDS awareness and promotion and prevention, a number of them working with youth-led and youth-serving organizations.
I saw it as basically crafting communication advocacy messages in a very captivating way, as captivating as possible, in the shortest way possible.
I personally found the participation to be excellent. All of the advocates came with a lot of energy and creativity and dynamism in terms of the work that they do. They have a really clear sense of their advocacy priorities and really keen insights into the political landscape in Uganda and how best to affect change.
The attendance was very good. What we are looking at is a number of 30 people. We didn't want to have a big congested number that we could not handle and for them not to take in this information. We thought 30 would be a very good number for them to understand the information.
That's helped me to know how to communicate further, how to break it down to people in the community, how to break it down to policymakers, because abortion is a very sensitive topic in Uganda. So knowing how to communicate in a very simple terms, but still putting your message across, for me was very important.
It is going to be beneficial to me with the work that we do to be able to get our messages that are usually very big. You know, we have all the statistics, and then we have the science, and then we are very passionate about our science because we understand it. And when it comes to speaking to other people whose job is not to actually understand the science, whose job is to take our science to another level, sometimes we get lost in what we are saying.
It is something that has not been so much common in Uganda to have evidence, especially around abortion, since you know that abortion in Uganda is legal, except in women that are at risk to, you know, giving birth. So to us as advocates of young people, it's very important, and we think we are going to use it forward as we do advocacy work in Uganda.
They are touching the sensitive topics that affect the youth, adolescent girls and young women. And for me, abortion is one of them. We've lost so many girls, so many adolescents in this country because nobody's openly talking about abortion.
This research says that almost half of the pregnancies in young people are unintended, you know. So this is very important for us to know first as advocates, but also to disseminate this information to the mothers, to the stakeholders, to even the girls in schools, because we do school outreaches, so that we can talk to them and, you know, find ways of preventing pregnancies or even making abortion safer in Uganda.
No, I would like to really appreciate Guttmacher Institute. The work that they do is very key, first of all, not just to me, but to many of the stakeholders in our field of work. It's very interesting. It's usually broken down with graphs, pictures, so we always find ourselves in one way or another on their website.
I really want to thank Public Health Ambassadors for their leadership and for their organizational skills.